In this video, we are going to be discussing about back spasms. Spasm is a condition where a muscle becomes extremely tight, it contracts and relaxes or sometimes remains contracted for a long period of time, and that condition is called spasm. Spasm can lead to very severe pain, which is either acute, which means it lasts for a short period of time and then gets relieved, or it can be chronic, lasting for a relatively longer period of time. So spasms in the back are some of the common causes, some of the common occurrences that one encounters. There are several causes for back spasms. One of the common cause is a renal stone. A stone in the kidney which is migrating through the urinary tract can produce very severe spasms in the sides of the back. The pain that is caused due to the spasm can radiate from the flank to the groin. A pain that is caused by this sort of a condition is very characteristic. So, stones in the kidneys and in the ureter are some of the most common causes of muscular spasm in the back. The other causes of back pain due to spasm is pelvic inflammatory disease. People with inflammation in the uterus, that is the cervix of the uterus, manifest as spasm or sudden tightness in the lower part of the back, which can be worse during the menstrual period or during the ovulation. So pelvic inflammatory disease and problems relating to the ovary and uterus can result in spasms in the back. Back pain due to muscular spasm can also be caused, especially in the upper part of the back, can be caused by a gallbladder stone as well. A stone in the gallbladder which begins to migrate can also produce very severe pain that is shooting from the upper part of the back. Sometimes muscular spasm itself is caused by postural issues. When somebody is either standing for a long time or sitting in an odd position, or when suddenly somebody stretches, it leads to a mild tear in the muscle which can then lead to a very severe muscular spasm lasting over a period of days. So these are some of the very common causes of muscular spasm leading to back pain, or back spasms as they are called. Some of the other very important cause to be understood is depression. Patients with very severe depression have chronic spasms in the back leading to consistent, very severe back pain that does not respond to all these interventions like painkillers or even to rest. Pain that does not respond to painkillers, especially due to muscular spasm in the lower back, and which does not also have the other characteristic diagnostic symptoms, signs and symptoms, as well as they are negative in all sorts of investigations. For example, you can take an MRI of the back, also do all the neurological examinations, look at reflexes and so on and so forth. A doctor, while examining all of those things, does not find any sort of problem, but the patient continues to suffer from very severe back pain. This could be a sign that the patient is actually suffering from chronic depression that is causing muscular spasms in the back leading to chronic back pain. So, it is very important for a person suffering from chronic back pain to see a qualified doctor and to get the condition diagnosed and treated appropriately. At AVN Arogya, we go through a complete investigation, a history taking and an investigation of the condition of the patient which leads to the back pain and back spasms. And according to the cause of the back spasm, we offer different varieties of treatments. At AVN Arogya, we offer very effective treatment for the entire different spectrum of causes of low back pain, but for gallbladder stone or cholecystitis leading to back pain, we find that Ayurvedic treatment is not very effective in getting relief from chronic back pain due to cholecystitis, whereas for the other conditions that cause muscular spasms or back spasms, AVN Arogya is able to offer very effective treatment, but led by a proper diagnosis of the cause of back spasm, and by offering herbal-based Ayurvedic medicines as well as Ayurvedic therapies. We are able to give lasting relief to most of the patients suffering from back spasms.